gathering my supplies. Everything is clean. Hi, my name is Ashley McClure. I'm a Kilgore College nursing student. Can I get your name and date of birth?
Hi, my name is Amy Kilgore, 5/19/1976.
Okay, and do you have any allergies that I need to be made aware of?
No, ma'am.
No? Okay, so today I'm going to be performing your musculoskeletal assessment. We're just going to be testing your range of motion and looking over your skin and just checking everything. Does that sound okay?
Ma'am.
My client's in a comfortable and safe position. Okay, so to start off, Amy, I'm just going to have you smile and frown. Do you know what you had for lunch today?
I had a chicken salad.
Okay, and is that a pretty normal lunch for you?
Yes, ma'am.
And do you know what month it is?
March.
And who's our current president?
Donald Trump.
Do you know where you're at?
At the hospital.
And who am I?
We're Ashley with Kilgore College Nursing School.
Okay, Amy, we're going to move on to vital signs. So you know how tall you are?
5'7",
And weight?
170.
And on a scale of 0 to 10, 0 being no pain, 10 being the worst pain, are you experiencing any pain today?
0.
0, okay. Have you had anything to eat or drink in the last 30 minutes?
No, ma'am.
Okay, so I'm going to start off taking your O2 and your temperature. This just goes on your finger and this goes under your tongue. Oxygen is 99 on room air. Temperature is 98.7. Now I'm just going to take your heart rate. So I'm just going to take your pulse. Heart rate is 82, respirations are 18. Now I'm going to take your blood pressure. Do you know what it usually sits at?
Like 120 over 70 or 75.
Do you have a preference?
No, ma'am.
So for this, you're just going to feel a tight squeeze and release, okay? I got 120 over 80. Okay. So now we're going to begin the assessment, okay? So to start, I'm going to have you do 1, 2, 3, 4, 1, 2, 3, 4. Okay. And now I'm going to look at your hands. Just looking at your skin color in between your fingers. Checking your capillary refill. And now I'm going to be checking your pulses bilaterally. Okay, and now I'm going to need you to squeeze. Perfect. Now I'm going to be looking at lower pulses. And since I'm here, I'm going to be checking temperature, feeling for edema. Now I'm going to be putting on gloves. And have my client take off her shoes. Okay, I'm going to be looking at the skin color of the toes, spreading the toes, checking the capillary refill, straight test, push up, and push down. Okay. Now I'm going to have my client put on her shoes again. So now we're going, do you use any assistive devices to walk or stand? Okay, so now we're going to be doing the gait test, okay? So if you can stand. So for this test, you're just gonna go heel to toe, heel to toe, heel to toe. Yep, and then turn around and go back, heel to toe. 1, 2, 3, 4. Okay, and now you're just going to do the same movements I do, okay? So we're gonna go out, up, here, big circle, here, down, and I'm gonna have you bend, and whenever you bend, I'm going to look at your spine. Okay, and now I want you to spread, and we're gonna squat, and then we're going to take our leg and go out, in, to the side, in, other leg out, in, to the side, and in. And then we're going to stick out and twirl our foot. Okay? And then the other legs, out, twirl. Are you experiencing any pain or tenderness whenever you do this?
No.
Alright, have a seat. Okay. Okay, my client's in a safe and comfortable position, call light in hand. I'm going to go perform hand hygiene, document. I'm going to go read this off to your provider. Do you need anything?
No, ma'am.
My client is alert and oriented ×4. Her nutrition is fair, nothing to be noted. Her facial expressions were good for the expressions that I had her do. Her skin and hair was appropriate for age and ethnicity all throughout. Her pulse was +2 bilaterally in the upper and lower extremities. Her vital signs were within range, nothing to be noted. She reported a 0 out of 10 on the pain scale. Her upper extremities and lower extremities, she had full range of motion. It was symmetrical and all of her limbs were intact. Her hands, her upper extremities had a 5 out of 5 on the strength test. Her capillary refill was less than 3. Her skin was even. There was no lumps, bumps, or bruising. Her hair was distributed evenly. Her lower extremities, I was able to get a 5 out of 5 strength test. Her capillary refill was less than 3. Her skin was good. There was no lumps, bumps, or bruising. Her spine, it was good. Nothing to be noted. No abnormalities. Her gait was smooth. Nothing to be noted. Her coordination was good. Nothing to be noted. Her range of motion was full, and she reported having no pain or tenderness during the assessment.